Hi there. Thank you for joining us for our virtual training on all things medical. This is for specifically individual reservists, IMA and PIRR. We're going to go over what you need to do to stay medically ready, as well as deal with any medical concerns or issues that might come up as when off duty or on duty. Try to explain all of that to you so that you can use it or take advantage of it when you need to, and also make it easier for you to understand how the readiness requirements work for medical and allow you to make those appointments and make sure you stay green to go. All right, I'm Lieutenant Colonel Erin Carl. I'm the Public Affairs Officer for Headquarters Rio. I'll be leading today's training. A big thank you to our SMEs at the HQ Rio Medical Office, because they are an amazing group of people who provide some pretty amazing services for our individual reservists, almost 8,000 of you. There's a lot here for them to keep track of. And so let's first just give you a quick overview of what we're going to talk about. The first is your IMR. That's really important. Staying green on things like PHA and dental, that can affect your ability to perform orders and get paid. So we need to make sure that you know how to successfully make sure that you stay green. We're going to talk about your treatment records, profiles, SHPE, and also things like waivers, line of duty determinations, MEDCON and in-cap pay. Non-emergent surgery is important for you to know about, what's authorized treatment, and we're going to talk a little bit about TRICARE coverage, mostly in such a way that I can tell you where to go to get more information. All right, let's first talk about your IMR. The first thing you want to do is go to the IMR website. Easiest way to do that is to go to the Air Force portal, type in My IMR, which will take you to the website. You will CAC into that. You can get to it on the personal side of your personal computer. And that's where you're going to see the dates and information, red, yellow, and green for your PHA and MHA, your dental, labs, immunizations, if you have any medical profiles or fitness testing profiles or med equipment. So this is a screenshot of what My IMR looks like when you check it out. There's a few things I want to point out here. You'll notice for this particular individual, they are yellow for PHA, which means they are coming due for their PHA. This will open up about 90 days prior to your due date. So the date of your last PHAQ, that's the online questionnaire that goes with your PHA. That date will be in there, as well as the last in-person PHA. The last time the provider reviewed your PHAQ is notated there. So all of the information, as well as for dental and labs, will be available on My IMR when you CAC in. I did want to point out also that very far side tab that says MTF instructions. I have certainly been assigned to units where I have found it very difficult to find a phone number or an organizational box email or something to get a hold of the MTF at my unit of assignment. Believe it or not, it's all right there. If you click on MTF instructions, you are going to see the information that you'll need to know, the phone numbers, what their suspenses are or requirements are for different readiness issues, clinics, that kind of stuff. So if you're not sure how to get in touch with your MTF, that's the place to go to find out. All right, let's talk about PHA, your physical health assessment. You're first going to start with your PHAQ. It's an online questionnaire. It's required annually, and it's valid for 120 days after you complete the PHA online, and you'll do that. You access it through your My IMR. So you're going to go into that same website, and if it's time for you to do your questionnaire, it'll give you a big button across the top to start it. If you're not yet close enough to your window, then it's not going to show you that button. This is important because this just changed, except for a few special job categories and for our flyers. The requirement for an in-person PHA every 3 years is no longer a requirement for individual reservists, which is pretty cool. The face-to-face visit is still required for flyers, some special operations, and other special AFSCs. But if you don't fall into one of those categories, you will no longer have an in-person requirement or a face-to-face requirement for your PHA. Now, that doesn't mean that they might not call you in if they see something on the questionnaire that raises a flag, but it's not an automatic in-person need every 3 years. The color coding on My IMR, very important. Green means you're good to go. Yellow, that's a 90-day grace period after the due date. So when you see yellow, you need to get your stuff taken care of because you're going to turn red after 90 days, and red is not good. We do not like to see red because that can actually impact your ability to perform orders and earn pay or work for pay and points. So, this can be kind of difficult, especially for some of us who tend to do our AT and IDTs all at once. You go back to your civilian life, if you will. But you still need to keep close attention to your IMR standing and make sure that you remain green. One of the things you can do is just add those dates into your calendar, pop a little Google Calendar or iCal reminder in there. Boy, I need to sometime this month get my labs taken care of, or my dental form when next time you go to your civilian provider. The mental health assessment is required annually. That is done virtually. Once you complete the PHAQ, you'll do that mental health assessment questionnaire, and you will schedule a phone call with a contractor who will call and just chat with you for a few minutes. And that sort of checks the box on the mental health assessment. So this is what I mean by that button showing up. So when you are within that window to do your PHAQ, that button will show. You'll click it and start going through the website. It takes about 10 or 15 minutes. After you complete your PHAQ, the system will give you instructions with a link to lhi.care. You're going to create an account if you haven't yet already. Make sure your email and your phone number are updated, and especially make sure that that phone number is a phone number where they can reach you, because they're going to schedule a phone appointment with you. So if it's not, a good phone number for you, then it's going to make it difficult to complete that. The system will email you with a link to schedule that phone call. And again, just make sure you put that correct phone number down so they can get a hold of you. It's about a 10-minute phone conversation. Now let's talk about your service treatment records. So the processing center receives hard copy records for members who have separated or retiring as of 2013. Those have been digitized, so they're moving everything to a digital record format. That's called HAMS, the Health Artifact Information Management System. Any MTF, it doesn't have to be your servicing MTF, any MTF can access your records that way. So it doesn't have to be that big paper file folder thing that only your local MTF has access to. And this applies to total force, reserve, guard, and active duty. The active duty military treatment facility is going to process any service treatment record transfers when you separate or retire. And you can request a copy of your medical record from about 180 days to 30 days prior to when you separate or retire. So that's just one of the things you should probably do on your checklist if you're getting ready to retire or leave the reserve. If you want that medical documentation, it's always important to have. You need to do that within that 180 or 179 day to 30-day window prior to separation or retirement. After you separate or retire, then you have to go through the VA to get those records. So if you have missed it, you can still take care of it, but you need to go through the VA. Now we need to talk about what counts as military medical, because some of the IMR tasks have to be done at a military treatment facility. So when you're talking about an MTF, what that means is an active duty or reserve medical treatment facility will sort of check that box, okay? So you have your servicing MTF at the unit where you're assigned, but all the IMR issues that you need to take care of, they don't have to be done, the in-person parts don't have to be done at your servicing MTF. You can go to any MTF. Now, for those of us who live in places where we're not anywhere near an MTF, there's a program called the Reserve Health Readiness Program, RHRP. And this allows, it's a sort of a contract thing that allows the Air Force to make medical appointments for you with a contracted civilian provider near you to take care of readiness items, that are necessary to do. It does take a bit of time for that request to be processed, and you have to live more than 40 miles away from any MTF, not your servicing MTF, not any Air Force MTF, but any MTF. So that could be Army or Navy as well. At our sister services, you can do your labs and you can do your immunizations there, flu shot, your HIV blood pull. You can't do your PHA and you can't do your dental. Those systems are different between the Air Force and Army and Navy. But if you have labs and immunizations that need to be taken care of and you do live near an Army or Navy facility, you could do it there. All right, let's talk about dental. Every third year, except for this year, because it was waived, but every third year you need to have a military dentist look at your teeth, an Air Force dentist. Remember the previous slide, dental is not something you can do at a sister service, MTF. Any of the other years you do, you can just go to your civilian dentist, which hopefully you're seeing them once or twice a year for a checkup and a cleaning. You'll bring that DD form 2813 and your civilian dentist can fill it out with the status of your teeth. You're going to turn that into your servicing active duty dental facility to update. Usually takes a couple days. Or if you're having trouble getting it updated or submitted to your MTF, you can submit it via MyPERS to the HQ Rio medical team and they can update it for you. And later on in the briefing, I'll show you how to do that. When your 2813 is filled out, they're going to mark whether you are dental classes 1, 2, 3, or 4. 1 and 2 are fine. 1 being the best, obviously. You've got a gorgeous set of teeth. Dental class 3, that just means that you have a dental condition that is being treated and your dentist expects that it will be resolved within 1 year. There are sometimes limitations if you are in a dental class 3, like IDT and AT at home station only. Harder to do formal schools, mandates, that kind of stuff. But you can still, do your fiscal year requirement. If you are dental class 4, that means you have not had your yearly exam, and that's bad. That makes you red, makes it difficult for orders to be approved. So you need to, obviously maintain contact with your civilian dentist because at least once a year you need to have a yearly exam. And then, as I said, for this year, the military dental requirement has been waived for fiscal year 21, but ongoing after that, unless more guidance comes out, every third year, you're going to have a military dentist look at your teeth and give you that exam. Now let's talk about labs and shots. Okay, the lab requirement, normally you don't need an appointment to go and get labs done, okay? Which for the most part is usually an HIV test. Most of the other stuff is done when you come in and it doesn't get done again. The HIV screening is due every 2 years. There is a 90-day grace period. Remember, that's where you're yellow on the IMR. It hasn't turned red yet. But you do have to do it at a DoD approved lab or MTF. And for some people that can be difficult. Unfortunately, that Reserve Health Readiness Program right now, that also doesn't suffice. So keep an eye on this HIV thing. If you don't live near an MTF, then you may need to get sort of ahead of the game and try to get that lab pulled, when you're out at an MTF, when you're doing your fiscal year requirements or whatever, to make sure that you maintain green on that and don't go red past the 2 years, 90 days. Immunizations, typically the flu shot, but there are some other immunizations you'll sometimes need. Again, generally no appointment is needed, but we do recommend that you contact whatever MTF you want to go to if you do want to get those shots done at an MTF, just to make sure that you don't need an appointment. Because you want to make sure they have the shots available, especially for things like the flu shot. Those tend to come in waves, right? The flu shot and a lot of the other immunizations can be done by a civilian provider. If you do get it done, if you do get it done by a civilian provider, you need to make sure that you get that documentation that has the lot number of the shot that you were given, when it was administered and by whom, the date, your name, and then that information gets sent to the servicing MTF or the HQ Rio Medical Office so that they can update your IMR. Okay, so you've got, if you get it done by a civilian doctor, your doctor or drugstore or something, you've got that second step of making sure that paperwork gets into your record. If you have a major change in your health status, you need to report it to your servicing MTF within about 72 hours, okay? If it's something where there's ongoing treatment for an issue, you broke a leg or something. Also, if you have elective surgery, you're supposed to be reporting that to your MTF as well. You are allowed, this is so important, you are allowed to use other MTFs than that to which you are assigned. If you're assigned, like I am, to Buckley Air Force Base, or Buckley Garrison as it is now, but you don't live near there, you don't have to go only to that MTF. You can go to any MTF. And that goes for fitness testing as well, by the way. If you live more than 40 miles from your unit of assignment, that means you can go to any MTF. You do not need to be in status to make the appointment. You should be in status for the appointment, but unpaid, points only IDTs will work for that. On the HQRIO website, if you go to readiness, there are 2 memos there that outline this block of information. One is sort of aimed at you to explain, what you have access to, and the other one is for you to hand carry and give to the MTF, because unfortunately some of them haven't gotten literally the memo that they need to provide service to you for your readiness tasks. So if you get any pushback from trying to get those appointments at an MTF other than the one you're assigned to, those memos may prove very helpful for you. All right, this is how you submit a ticket on MyPERS if you need to get your dental form updated, your flu shot updated. So you're going to go to IMA Management and click on, you're going to go to MyPERS, and then along the side, there's that IMA Management link. You're going to click on that, which brings up this page right here. At the top part, it's one of the selections is medical. You're going to select medical, and then click Submit Medical Requests by clicking here. This is where you're going to tell them what you're submitting. It just makes it easier for our technicians to know what they're going to be looking at when they open your ticket. They can take care of things all at once. So just, if you're submitting your 2813, that's Rio Dental. If you're submitting a flu shot, that's labs and immunizations, okay? All right, so this is another important thing to know. If you are doing your fiscal year requirements, your AT and your IDTs, or if you're on any kind of military status of fewer than 30 days, there are only certain things medically that you can have taken care of, right? I.e., you're not going to go on 2 weeks of orders and go and have some, long-term medical condition taken care of. That's not the way it works. So wellness care and your readiness items, your PHA, dental exams, immunizations and labs, and urgent care. If you get sick, if you break a bone, if you injure yourself while you are on duty, and that may require a line of duty determination to be initiated to make sure that the records reflect that you were in a duty status when that sickness or that injury happened. But yes, you can seek medical care from an MTF while you are on status of fewer than 30 days, but only in these specific instances. Okay, now we're going to talk about profiles. So your active duty MTF is responsible for creating your profiles. They're not responsible for your treatment of whatever it is that you are on profile for if you are not on long-term orders. So it is possible for you to get documentation from your civilian doctor about whatever the condition is and submit that information to your active duty servicing MTF, and they can create the profile for you based on that. They may ask to see you. You may need to explain that you live 7 states away and work that out. You can also go to a nearby MTF to get that profile created. It doesn't have to be at your servicing MTF, okay? So the treatment plan needs to include the diagnosis. It needs to include how long it's expected to last. And specifically, your doctor needs to say what you can and can't do as far as fitness testing goes. You can do the walk, but you can't do the run. You can do sit-ups, but you can't do push-ups. It needs to be very clear. Also, if there are duty restrictions for whatever job that you do that you're not going to be able to do. And this, by the way, this goes for maternity stuff too. That just needs to be listed down there so that when they create your profile, it encompasses what you can and can't physically do as a result of whatever condition is creating the profile for you. There are mobility restricting profiles. If you need more information about this, there's more information on MyPERS and with the HQRIO medical team. There are these codes on the profile. A code 31, which is also a DAV code 41, that's a temporary condition resolving within a year. If you need medical board processing, that's a different code. We have a specific code for pregnancy. So if you are on a pregnancy profile, you'll have a code 81 or DAV 49. So code 37, which is one that requires medical board processing, it's important for you to know that while you await that, if you're unable to participate for payer points, any participation you do, you have to work through your debt commander. So it's, you may be able to do something, but you have to work through your debt commander for that, because there could be all sorts of issues if what's going on with you requires med board. All right, your SHPE. So the purpose of a SHPE is that it ensures your medical conditions that occurred while you were on long orders are documented so that they can be followed up with the VA for follow-on care. It also facilitates VA disability claims. You can do it, there's web-based and there's an in-person part of it. So you want to do it when you're just coming off of long-term orders, not more than 30 days prior. It applies if you're on an AGR tour. It applies on if you're on orders of more than 179 days of active duty orders or MPA, RPA, or more than 30 days of continuous service on orders if it's contingency. There's the DoD instruction if you need to learn more about the SHPE, but it's, you want to have this stuff down on record, right? If you've become ill or had an injury while you were in status, you need to have documentation of that. And that's the purpose of the separation, history, and physical exam. All right, now, if you are have been returned to duty following a med board evaluation, you may be given an assignment limitation code or a DAV code, and that limits where and what duties that you can perform as a result of whatever condition led to you being med boarded. If you desire a modification waiver or deployment waiver, that goes to the AFRIC SG. You can ask questions to our Rio medical team about this if you have more concerns or questions. If you are trying to deploy, but you have a C1 or C2 code, that requires a waiver. And also requires the gaining MAGCOM approval in addition to AFRIC SG. Code C3, that restricts you to IDTs and AT at home station only, okay? Modification waiver is used to request anything outside of those limitations. So if you need to go to a school or if you need to do your AT at an alternate location, then you need to request a modification waiver to that assignment limitation code. You need to submit it at least 90 days prior because it takes time to process those things. And it also only applies to a single event. There's no like blanket waiver, from here on forward kind of thing. Now we're going to discuss line of duty. So if you're active duty, with some caveats, but it's more than obvious usually that what happened to you was in the line of duty. But if you are a reservist, that's not always the case. So if you've got an injury, an illness, a disease, or if you pass away while in status, a line of duty investigation will determine whether the condition existed prior to service and if that condition was caused or worsened by military duty to help determine whether you are within the military line of duty when that whatever horrible thing happened to you. If you are absent without approval, if you were determined to have committed misconduct, or if whatever happened to you was deemed not caused by military service, then that might be labeled not in the line of duty, okay? A line of duty investigation needs to be started fewer than 180 days from the release of your active duty or your IDTs or whatever status you're in. Any incident or injury should be reported to your active component commander and the active duty MTF within 24 hours. You should also let HQ Rio know as well, medical, and you can submit that through MyPERS. But if something happens to you, you need to document it, okay? It all goes back to documentation when it comes to a lot of this stuff. There's an Air Force Form 348. You'll complete that with your active component commander and MTF, and then that gets sent over to medical HQ Rio for processing. So if the condition, the injury, the illness, whatever, was found to be in the line of duty, then you can receive treatment for that condition through TRICARE and the VA. Up to 12 months from diagnosis, the care is provided through TRICARE via the MTF or by civilian providers, depending on where you live. After 12 months, that gets taken over by the VA, okay? So you may have heard before about MEDCON orders. The purpose of MEDCON orders is to continue to keep you in status to allow you to receive that medical care. Okay, so if you determine you must have a line of duty determination to go on MEDCON orders. The purpose of those MEDCON orders is to keep you in status while you are treated for the condition or injury or illness that was determined to be in the line of duty. The LOD also allows for medical retirement to be received if what happened to you disqualifies you from military service, okay? So pre-MEDCON orders, that's a case where you're already on orders, but they need to do an LOD on you. So they're gonna put you on pre-MEDCON. That allows the MTF to initiate that line of duty investigation and give time to them to determine whether the condition rendered you unable to perform your military duties, to provide medical documentation in support of a request for MEDCON orders. Okay, because remember, MEDCON orders, you have to have that line of duty determination already. But they'll put you on this 30 days of orders to just keep you from having a break in service, keep you in status while they do all this investigation. It facilitates the initiation of an LOD and allows them to put together and submit that request for MEDCON orders, which can be a little time consuming. Again, you know, if you make bad choices, there's misconduct, or if you're trying to take leave or something like that, they're not going to issue the orders for that. It's simply to give time for an LOD to be investigated. So the approval authority rests with the Case Management Division at Air Reserve. So ARC-CMD. Approved MEDCON allows the member to be on full-time orders for treatment of that service-connected injury or illness, or service-connected aggravation of conditions. Any request for MEDCON, that submission goes via MyPERS to the HQ Rio medical team. So if you think you need to be on MEDCON, you need to let them know via the MyPERS submission. If you are not currently on orders, you have to have a completed and approved LOD to do the MEDCON request, which is why we have that whole pre-MEDCON thing if necessary. You cannot backdate MEDCON orders. It just, the facility to do it doesn't exist in the reg. The Air Force Board of Correction Military Records is the only option if you do need potential back pay for a period of time on which you should have been. So you can't backdate the orders. You would have to go through a correction of your military records. All right, let's talk briefly about INCAP pay, incapacitation pay. This can provide for a loss of your civilian wages if you are unable to return to your civilian job due to something that happened and was determined to be in the line of duty, okay? So you need to have at least an interim line of duty determination to request INCAP pay. It needs to be reviewed by a medical provider, a military medical provider. And if you have to get INCAP pay that goes on beyond 6 months, it actually goes up to Secretary of the Air Force for approval. But for instance, if you are injured while on your annual tour and that injury is going to keep you from being able to do your civilian job, this can help cover those loss of wages, again, with a LOD that has been determined. Non-emergent surgery requests. So this only applies if you are on orders of 30 or more days, okay? A non-emergent surgery is non-acute, non-urgent procedure, medically necessary to provide relief from undue suffering or symptoms that could cause health problems. Now, normally I hate reading from a slide, but I think that is a really important thing to make sure you really understand. If you are on orders of 30 or more days, and you want to request surgery or a procedure that's medically necessary, we're not talking about cosmetic procedures here, but you want to have the Air Force provide you with this medical procedure that's necessary to provide relief from suffering or symptoms that could cause health problems, but the actual thing that they're treating is non-acute and non-urgent. That's what this is for. It's required for members within 6 months of their long-term orders ending. Basically, if you're on year 1 of 3-year-long orders, then you don't need to do it. But if you're coming up on the end of orders and you want this kind of procedure, you need to have this request approved. AFRIC-SG is the approval authority for reservists who request this, and you can contact Rio Medical again through MyPERS to get the consent form and to process the request. This is important. If you go ahead and do the procedure, the MTF, the active component MTF, a lot of times they're not paying attention to this stuff because they're not reservists, right? If you have the procedure without the approval, the military could bill you later if they come back and say, we wouldn't have approved this. And that's probably not a bill you want to pay. Also, if you had complications from the procedure, that could be found to be not in the line of duty, which would also be not good. So if you have any questions whatsoever about if you're on orders and you're having a procedure done that is not, I mean, it's not setting a broken ankle, that's an urgent procedure, right? But if it's a non-urgent, non-acute procedure that's happening, when in doubt, put in the request for this first before you get the procedure done, because if they weren't going to approve it, you might be on the hook. And then obviously if complications happen, that would be awful to not have that be found to be in the line of duty. All right, lastly, we're going to talk briefly about TRICARE. If you are on long-term orders, you go on TRICARE Prime just as if you're active duty. However, for reservists who are not on long-term orders, if you do your AT and IDTs and that's it, you do have access to TRICARE Reserve Select. You can cover you or you and your family. There is a monthly premium. It's pretty affordable, and dental is also available for TRICARE Reserve Select. There is TRICARE Retired Reserve for those who are you can continue to receive those health benefits after retirement. There is a monthly premium. This is what bridges the gap until you start collecting your retirement, because when you start collecting retirement at age 60, then the regular active duty TRICARE kicks in. So this is the website you want to go to. You do want to pay attention to whether you fall within TRICARE East or West, and that just depends on where you live. But there's a wealth of information on the TRICARE websites to help you determine the differences between TRICARE Reserve and TRICARE Reserve Select, Retired Reserve, Prime, Remote, etc. When you are on long-term orders, you as the member who's serving on those orders are moved to TRICARE Prime. It's basically active duty health insurance, right? If you are on orders of 30 or more days, you should automatically on that first day of orders be moved to TRICARE Prime, regardless of whether you were on TRICARE Reserve Select or not. It's always a good idea on that first day of orders to call TRICARE and verify that you have been moved over, because you need to be assigned to a primary care manager, okay? TRICARE Reserve Select doesn't have PCMs, which is kind of nice, but if you move to TRICARE Prime, you do have to deal with going to a PCM for referrals, so they need to make sure to assign you to one. Dependents can also be enrolled in TRICARE Prime while you are on long-term orders, or you can put them on TRICARE Reserve Select if you prefer. Some people prefer to do that and not have to deal with PCMs. When your orders are ending, you need to call TRICARE to place you back on TRICARE Reserve Select if you're normally on TRICARE Reserve Select. If you're not normally on TRICARE Reserve Select, you'll just fall off of Prime when those orders end, usually. This is important for those who don't live near an MTF. There is TRICARE Prime Remote. I'm actually on TRICARE Prime Remote. I work remotely from my home in North Carolina, and the nearest MTF to me is a 72-mile drive. Because of that, my family and I are on TRICARE Prime Remote, and my PCM is actually a civilian doctor here in Raleigh, which is kind of nice. I don't have to keep driving out. So just because you're on orders and you may not be near a military medical treatment facility, don't think that you can't still take advantage of the TRICARE Prime that you are entitled to as serving on those long orders. These are just a list. This is a list of a few things to keep in mind. If any of these things apply to you, they can add an extra level of thinking and frustration, possibly. Dual coverage households, that's a big deal. If you've got reservist married to reservist, reservist married to retired, reservist active duty, it can be very confusing. For instance, a reservist active duty, well, the active duty has Prime, but the reservist is usually dependent, but then they go on long-term orders, now they've got their own Prime, so it can get very confusing. It's usually always best to call TRICARE on the first and last day of those orders and make sure that you're put into the correct status that you need to be in. If you are OCONUS, There are different TRICARE coverages for overseas assignments, and it matters whether or not your dependents are there as part of command sponsorship or not. It can get kind of complicated. So if you think that might apply to you, you really need to dig into that section of the TRICARE website, maybe call and talk to somebody to make sure that you fully understand how that insurance is being applied. Because you don't want to wait until, you know, goodness, somebody sprains an ankle or something and you're trying to figure out how your insurance works. If you are pregnant, there's scheduling for certain appointments. If you want to keep your regular doctor, again, always good to call and talk to the good people at TRICARE to get that figured out. And that also goes for any other ongoing medical issues, right? Because if you're on TRICARE Prime, you have to go to a PCM to get referrals. That can take time. If you've got like regular treatments for something. So these are all special cases where you should be dealing with your MTF and with TRICARE to make sure that, you know, all your appointments are set up and you're going to be receiving the care that you need. So I believe that is my last slide. It is. That pretty much wraps it up for all things medical. And I am trying to switch my slide here. There we go. Okay, that wraps it up for all things medical. The slides, of course, available on our website along with this recording. There is also a quick guide, IMR at a glance, that will tell you everything you need to know about labs and immunizations and everything to stay green to go. You have to stay green. I know it can be very difficult when you have a full-time civilian job and all the other stuff going on and you haven't been, you know, it's been months since you've served. That happens to many of us who serve in this capacity. But as a member of the military, you have to maintain your readiness and you have to stay green. There are a lot of programs and ways to help facilitate that for you. If you ever have any questions, you can contact HQ Rio Medical through MyPERS or even call and ask at your debt and see if somebody there can give you a hand. We are totally here at HQ Rio to make sure that we make it easy for you to serve. And if that also means helping to set up an appointment through the Reserve Health Readiness Program, or make sure you understand when you're supposed to get, you know, your PHA done or whatever, we're here to help. But when you see the messaging about, hey, your flu shots are due, or hey, you know, you're red on your dental, you need to take care of that. We need to maintain our readiness as individual reservists and IMA and PIRR so that we can serve and serve well. So that's it for all things medical from HQ Rio. Thanks so much.